Good morning, everyone. As the 133rd president of this organization, I am grateful for your confidence in me as your representative of this prestigious and effective organization. My involvement with Arizona Medical Association dates back to 2000. Initially, I served as the president of Pinal County Medical Society, then as a board member, a member of nearly all the committees, secretary, and now your president. Thank you. Thank you for trusting me with this role. During my medical school in Pakistan, I was a student leader, fighting against military dictator for basic human right and democracy. I have been beaten up and jailed. From a young age, I decided I would always fight for people with fewer opportunities. During my residency, I was the president of house staff addressing the issues of trainee physician because I believe in organized medicine. I moved to Arizona 27 years ago after completing my fellowship in gastroenterology at Loyola University. I was initially supposed to start a faculty position in GI at Indiana University, but life had other plans. A colleague of mine, Dr. Safdar Zaidi, a nephrologist who did residency with me, moved to Arizona. He persuaded my wife, believe me, he did, and I to come to Arizona for at least a year. I started my practice in Casa Grande, where the hospital provided me office space initially. I was surprised to see many young people with advanced liver disease and cancer. I called my chief at Loyola University, Dr. Frank Iber, and explained to him what I was seeing. The first thing he said, Nadeem, don't drink tap water. And then he explained me, all this toxin going into the water. And followed by, he said, this is an ignored population. The second statement about an ignored population struck me deeply. It was hard to comprehend why these people, just 30 miles from big cities, were ignored. The people in Casa Grande were the nicest I could imagine. Because of them, I decided to stay. And it's now been 27 years that I have been practicing in Casa Grande. While practicing in Arizona, I realized the only organization fighting for our patient and colleague was Arizona Medical Association. I joined ArMA in 2000 and became the president of Pinal County Medical Society. This was when we used to have county medical societies under ArMA regions. So some of us maybe remember those days. I witnessed firsthand how the Arizona Medical Association fought many terrible and harmful laws trying to pass in Arizona State, Senate, and House that would negatively affect the health of Arizonians. Over the past 27 years, I have faced numerous issues affecting my practice, not only mine, but yours too. Our reimbursement keep going down while our practice costs keep rising, forcing many of our colleagues to quit private practice and join corporate medicine. This is the only profession where your income has consistently decreased over the last 10 to 15 years. During my term, I will ensure that ArMA continues its collaboration with national-level organizations such as the American Medical Association, so that we effectively fight against decreases in the reimbursement and ultimately secure fair and timely payment so that our practices can move beyond struggling to survive. It is vital that we work together, compound our effect, and speak with one voice, both nationally and locally. Throughout my time practicing, I have realized that doctors and their practices lacks the negotiation skill and power needed in dealing with insurance companies for reimbursement. So, focusing on the same issues at a local level, I will explore how ArMA can start a process to help physicians negotiate with the insurance company, furthering the work we have already done around commercial medical insurance reform. Besides practice viability, there are other issues such as the expansion of scope of practice from group without proper education and training. While increasing access to healthcare is important, it should not come at the cost of quality. The excuse of providing dismal care being better than no care is wrong. Any expansion of scope of practice must be done with careful consideration of the education, training, capability of the practitioner. When it comes to health and life, everyone deserves same standard of care. On one front, we will continue to tirelessly and loudly advocate for physicians, patients, and a strong healthcare policy. Across all demographics, our patients deserve evidence-based, compassionate, optimal healthcare fueled by physician-led care team. That's why our legislative committee, in conjunction with our lobbying team, spend more than 5,000 hours each year speaking with one unified voice on behalf of Arizona physicians at the Arizona State Capitol. Over the next year, I will ensure the Legislative Committee receive all the support needed to continue fighting these frivolous policies. Physician scarcity is a national issue, especially in rural areas. The shortage of primary care physicians, specialists, and nurses is a gigantic issue in Arizona. We have 3 medical schools and 2 osteopathic schools, and 1 more is in process. Unfortunately, there is shortage of residency slot. The doctors we produce must leave Arizona for their training, and they often stay where they complete their training. We must urge our politician and governor to increase GME funding to create more residency slots in Arizona, keeping our highly trained physicians for our Arizonians. I will establish a task force to educate our lawmaker and governor about what is needed to secure more GME fund. I am also focusing on giving back to the community. Tonight's Heartbeat fundraising gala is the first step toward this goal. Thanks to our immediate past president, Dr. Hart Markel and Dr. Mariam Anand, who created a childhood obesity prevention task force, which I had the honor of chairing with a dedicated team, including Dr. Fred Kogan and Mike Hammond, together with Dr. Anand and Hart Markel. In the last 40 years, we have tried our best to prevent childhood obesity, and we review the literature. And each time we approach this issue, we ask children not to eat this, or to eat this, not to do this, or to do that, and it fails. During this last 40 years, the childhood obesity increased by 8 times. We are trying to see if we take a different approach. Instead of telling kids what to do, make a partner in this study. We are going to educate in 3 different areas, Scottsdale, Casa Grande, and Sacaton school districts, and educate those children with cartoons what happened when you eat, what happened to fat, protein, carbohydrate, sugar. And once they understand that thing, then we will share with them what is right thing, what is wrong thing, and ask them how you will approach, how you will choose to eat right. So we will make them a partner, and that data we will collect. Tonight we will also raise funds to start protocol writing and implement the childhood obesity program in Arizona, which we will call Childhood Healthy Living Choices, not obesity. We will also raise funds for medical student scholarship, which we already have begun, but which we will expand upon greatly. And additionally, we will provide a scholarship to nursing school to keep nurses in Arizona. And we will promote the concept of blue zone communities, which the mayor of Phoenix has already implemented in South Phoenix, and I'm trying to bring it to Casa Grande, as this program has shown improvement in healthcare outcome and addressing the issue of healthcare disparity. Membership. A strong membership is the key. I believe every physician in Arizona should be the member of ArMA, not because I'm ArMA president, because that's the only organization who's fighting for you. We have to address issue collectively. We cannot fight individually. We will be working with other medical organizations to work on discounted membership fees if they are member of more than one medical society. And I thank ArMA office staff starting from Libby, Michelle, Shelby, Susan, Cher, Amanda, Eva, and many more. Believe me, without them, we cannot even take a breath in this room or outside in Arizona. Thank you very much. Before I finish, I want to thank my family, my wife Shani, who manage my practice and try to manage me, which is very difficult. And but without her, I could have not done what I've done in my life. She let me take big jumps from here to there, and she stand by me. So I thank to her. We are all volunteers running this organization with the help of the management team, and I salute you all for your leadership and volunteerism. You dedicate your precious time to guiding ArMA to help your patient and colleagues. You are all special, and I need your help to provide a strong platform for our future generation. I'm looking forward to a great year ahead. Thank you. Thank you for your support.